Good morning, everyone. Thank you so much for joining us today for How Anti-Gravity Technology Can Help, brought to you by AlterG. My name is Amanda, and I represent our marketing department. I am pleased to introduce you to Jacon Chun, AlterG's clinical specialist and physical therapist. He will be walking us through the many applications of the anti-gravity treadmill, and I think you will enjoy his presentation. If you have any questions, you can type them into the Q&A box on your screen or into the chat box, and we will address those at the end of the presentation. Once again, I hope you enjoy this, and we appreciate you joining us today. Thank you so much. Jacon, you can take it away when you're ready.
All right. Hi, everybody. I hope you can hear me. Is the audio, is it okay?
Yes, we can hear you.
Okay. Well, thank you, Amanda. Again, my name is Jacon Chun. I'm a physical therapist with Texas PT Specialists in the Austin market, and I've been a clinical specialist with AlterG since 2010. I was introduced to the product initially when I worked at Stanford University in Palo Alto in their sports medicine department. So I've been using the prototype since probably closer to 2005, 2006. But I've been a clinical specialist with AlterG since 2010. And what I wanted to do today was to kind of talk to you all about our anti-gravity technology. We'll talk a little bit about unweighting, progressive loading theory. From there, we'll highlight the differential air pressure technology that we use at AlterG to provide body weight support. We'll talk about how to use anti-gravity treadmills in rehabilitation, some of the theory behind it, and then especially clinical applications, what types of patient populations, diagnoses, who would be appropriate for the AlterG. And then lastly, we'll leave some time open for questions that you might have regarding clinical applications or the product itself. So let's talk a little bit about unweighting progressive loading. AlterG technology is different. It's new in that we use air pressure, but the theory behind what we do is not new. Body weight support has been around for a long time in physical therapy. People use harnesses to provide body weight support, or there's underwater treadmills, people perform aquatic therapy. So there are ways that people have been doing unweighting and progressive loading. Now, why would you do it? Why do you want to provide this type of modality or option for people in treatment? Well, for orthopedic conditions, you want to encourage active range of motion. So someone just is recovering from a surgery, they've got an orthopedic injury, they may have osteoarthritis, you want to get them moving as soon as possible. Well, if the load, if full body weight is too much, then they kind of need to have some type of reduced body weight condition. So they might use a shuttle leg press machine, they may use a total gym. Again, they can use an underwater treadmill to load the lower extremities at partial weight bearing, and they can that way encourage movement. You're also able to protect healing tissue, so you can get them in these situations without causing stress to the surgical site, to the injury site, and again, you can just get someone moving faster. You can start close kinetic chain activity sooner, which we all know is better for rehab. You get co-contractions of muscles, you stimulate proprioceptors, it's more functional than doing something open kinetic. So we want to get people in these positions, in these situations, in these environments, and now we can do it when you have body weight support, safer, you can do it more comfortably for these patients, and so we can move them along faster in the rehab progression. The goal to get someone in weight bearing is, of course, you want to normalize their gait mechanics. You don't want them compensating for too long. You want them getting back to, walking with full extension, with, full weight shifting, with proper loading. And so the sooner we can do this, the better results we see. And then for athletes or people that want to, train, they got to maintain aerobic conditioning. So if they're recovering from a stress fracture, Achilles tendonitis, patellar tendonitis, they can still maintain aerobic conditioning even at reduced body weight. So if they're training for a race, they don't have to lose a lot of the conditioning which they developed already. They can maintain it while they're healing, and they can start back up at a higher level. Body weight support is also used in neurological conditions. We see this mainly with harnesses over treadmills or over ground to help people with neurological conditions normalize their gait patterns. So these types of body weight support systems can provide static and dynamic standing training. So you can work on reaching, you can work on weight shifting, you can work on pre-gait activities. It's functional, so people are able to, practice activities that are going to get them back to independence, back to home. That's the point of these types of devices. Gait training, of course, helping people, step appropriately, helping them, again, properly weight shift, have proper stance time, swing phase. And then encourage motor learning. So with harnesses over treadmills, you can do a lot of repetition of a task-specific skill, walking. So patients hopefully will learn this and develop the ability to carry over what they're getting to over ground walking. At AlterG, all we've done is taken that theory of body weight support, unweighting, progressive loading, whatever you want to call it, and we're using differential air pressure technology. So instead of using a harness, instead of using a pool, all these ways that you can provide body weight support, we're using air pressure in our treadmills. So what is differential air pressure technology? Well, it was developed in NASA by Dr. Robert Whalen and Dr. Alan Hargens, probably late 80s. And what they were doing is they were studying the biomechanics of exercise in space. So it started with loading treadmills so that you could have astronauts train in space, because when they're not loaded, when they're in an unweighted setting, what happens is they develop muscle atrophy, osteoporosis. So they were looking for ways to exercise them in outer space. So the initial loading treadmills used a harness, which wasn't that comfortable. And so Dr. Robert Whalen and Dr. Alan Hargens started looking at using air pressure and differential air pressure to provide loading. He patented the technology and then licensed it to AlterG. And then AlterG has been using it to do some unweighting or unloading to provide body weight support in the rehab setting. So if we look at some of the pre-marketing studies that they were doing at NASA, what they found was that lower body positive pressure was effective at reducing ground reaction force, which makes sense. If we're able to support someone and adjust the amount of air in the chamber, that reduces the amount of impact that they feel with heel strike, with body weight activities. There were nominal cardiovascular changes, so nothing significant as far as blood pressure, heart rate. And it didn't require a lot of pressure to get a lot of support. Just 1.1 PSI could provide up to 75% body weight support. So this is one of the hallmarks of the AlterG differential air pressure technology, is that because it doesn't take a lot of air pressure, it's really comfortable and patients don't mind being in it, as well as we're able to preserve normal gait and running mechanics. So differential air pressure technology is able to provide this precise support that you can't get with a harness or a pool. If you take a look at this graphic, a harness is great if you don't need to provide a lot of support. So if you only want to unweight someone just a little bit so that they're safe, so they can work on their gait, it's great. But if you really want to provide more support, if someone needs it, it's not going to be comfortable. The straps are going to be pushing in on the pelvis, on the groin. It's going to be pulling really uncomfortably, and they don't want to be on it for very long. In a pool, it's the very opposite. If you want to provide a lot of support, it's great. So someone recovering from an orthopedic injury, even someone that has neurological conditions, they can use it if they need a lot of support. But what if you only want to take 10% of body weight off? What if you want to get someone to load themselves back up to overground situations? You can't just remove that little bit of support. It's usually good for from 20 to 50% of body weight support. At AlterG, because we're using air and because we can control it in 1% increments, we can cover that whole range. We can go from full body weight all the way down to 20% of body weight in those little 1% increments. So that one device covers your whole spectrum of patients. You don't need to get a harness if you already have a pool, and vice versa. You don't need to look for a pool if you have a harness. If you get the AlterG, you can cover this whole range. So with AlterG anti-gravity treadmills, you get precise, controlled, progressive loading. Again, you can measure in 1% increments, something you can't really do with these other types of body weight support. You get that larger effective range that goes from 100% full body weight all the way down to 20%. Greater comfort and safety comes from, again, the fact that you only need 1.1 psi to get a fair amount of unweighting of body weight support. So patients like it. They don't mind being in it. We have neuro patients that use it for 45 minutes to an hour to practice standing, weight shifting, gait training. So you can imagine the amount of repetition, the amount of mass practice that they can get to encourage motor learning. And again, because it's comfortable, because we're not introducing resistance like you would get in water if you're doing aqua jogging or underwater running, you get normal gait and running mechanics. And with the addition of Stride Smart technology, which is available now, you can get real-time gait analysis. So you can get data on weight shifting, stance time, step length, things that work on helping patients see what they need to do to normalize their gait mechanics. So let's move on now to talk about how you use this technology, how you use this body weight support in rehabilitation. So what do we know about anti-gravity treadmills? Well, the AlterG is safe. That was established at NASA, and we have other research that also supports that. AlterG can assist in decreasing ground reaction force to the lower extremity. Again, NASA provided research on this in their pre-marketing studies. We've also got more current data with the anti-gravity treadmills. AlterG maintains normal mechanics. It can produce a training effect. And it's an effective post-operative, post-injury rehab tool. Let's take a look at some research that highlights these findings. So this study looked at what would happen with people inside an anti-gravity treadmill. And they saw that when they measured blood pressure and heart rate, there wasn't a significant change. A slight increase in systolic blood pressure, but no change in the diastolic. A slight decrease in heart rate, and a little bit of a fluid shift from the legs to the abdomen, which you would expect because of the pressure in the treadmill. So AlterG is a safe exercise or training option for those with cardiovascular conditions. It's not going to provide a lot of effect whether you're a cardiovascular patient needing conditioning, you're an athlete that wants to use it for running. There's not going to be a big change in these parameters, so it's a safe training and rehab tool. The anti-gravity treadmill reduces joint compression force. So not just ground reaction force, but in this study conducted out of the Scripps Institute in La Jolla in Southern California, they looked at 4 patients that had a smart sensor in their total knee prosthesis. They were actually able to measure tibiofemoral joint compression force. So not just ground reaction, but we're looking at joint compression force in the knee. And they saw that joint compression force jogging at 50% body weight was the same as walking over ground. So for patients that want to increase cardiovascular activity or want to return to running, if you've had a joint replacement, a lot of times it's not recommended. Well, in the anti-gravity treadmill, we know you're not going to be putting any more stress to those joints than you would be walking over ground. We could also assume that that type of carryover would occur not just in the knee, but the reduction of joint compression force would occur at the ankle, at the hip, even maybe the lumbar spine, because you're reducing ground reaction force. So AlterG provides accurate and precise joint unloading. It's a great tool that you can use for patients that have osteoarthritis, that are recovering from total joint surgeries, that might be recovering from other orthopedic surgeries or injuries. The anti-gravity treadmill is able to preserve gait mechanics. So in this study, they looked at the influence of body weight on lower extremity muscle recruitment. And what they saw was that the EMG activity of anti-gravity muscles decreased. So when you're looking at rectus femoris, your calf muscles, hip extensors, those decreased, but the pattern in which they fired was preserved. So normal gait mechanics is preserved. The only difference is that they're not at peak contraction or peak activity when you reduce body weight, because you don't need to absorb the same level of ground reaction force. Anti-gravity treadmills are effective training tools. So because ground reaction force is reduced, while being able to preserve muscle firing patterns, you can use the AlterG as a great tool while you're recovering from surgery, while you're training for a sport. You can reduce metabolic demand for those who are deconditioned. So it's a great tool because you can still maintain that training effect. And if you're looking for a specific formula or an equation, this research shows you that. I usually recommend people just use a heart rate monitor. And what you want to do is try to get that heart rate monitor up to your target heart rate, whatever body weight you're at, and then you know you're at your training effect. But if you want a formula, this is a formula that you can use to know how much you need to increase speed to get the equivalent workout. So again, a training effect can be obtained. You just need to manipulate the environment inside the anti-gravity treadmill. So how about clinical applications? How would you use it? What types of patient populations? Well, AlterG can be used to decrease post-operative or post-injury pain. You can use it to restore normal gait mechanics in both orthopedic and neurological patient populations. It can allow for safe motor learning, which is key for your neuro patients. You want a lot of repetition, a lot of mass practice of those task-specific skills. AlterG is great at decreasing fall risk. So you can work on step length, walking speed for your elderly geriatric populations. And it can provide safe aerobic conditioning for your athletes and people returning from injury. So orthopedics, this was the initial patient population that AlterG anti-gravity treadmills were used for. Looking at runners as they're recovering from stress fracture, athletes and patients as they're recovering from orthopedic surgeries like ACL reconstruction, total hip, total knee, post-injury patients as they're recovering from Achilles tendonitis, patellar tendonitis, and as an adjunct for training. So patients were able to kind of start using the AlterG while they're recovering and not lose out on their cardiovascular conditioning. One of the cool things that we see with people using the AlterG is that for total patients, if they want some type of cardiovascular activity or some type of range of motion for patients, it's hard to get them on a bike because you may need to follow your post-operative precautions. Well, with the anti-gravity treadmill, you don't need a lot of hip flexion to get into it. So you can kind of preserve those and respect those precautions while allowing someone to return and start walking safely. So in orthopedic populations, we can reduce body weight to as low as 20% to alleviate pain and encourage mobility and movement. We can get people walking sooner to get them back to those normal gait mechanics, all while preserving the healing, protecting the healing tissue. Again, with earlier incorporation of closed kinetic chain activities, you can encourage co-contraction, you can work on proprioception, you can work on loading tissue safely, because the loading response is what produces healing and stimulus. So if we get people up sooner and they're more active, we can decrease that disuse atrophy and we can encourage neuromuscular control. So AlterG encourages earlier mobility for your orthopedic patients. In neuro, we see people using it with patients that have a variety of diagnoses. I always get questions about whether it's appropriate for a certain diagnosis, TBI, CVA. What I always tell people is that it's not usually if the patients are appropriate, it's when. So if you think about their functional abilities, right, are they able to stand? Are they able to weight shift? Are they able to kind of work on, some pre-gait activities? If they're at a level where they can kind of transfer safely, if they can kind of perform a sit to stand, they can stand for a short amount of time, then they're appropriate. It doesn't really matter what diagnosis. If their functional abilities allow them to do things where they can work on standing, weight shifting, walking, the AlterG is an ideal tool to get in more repetition and more practice for these patients. So the differential air pressure technology provides more comfort for these patients in a body weight supported situation. So they're able to practice longer and again, get more repetition for greater motor learning. More confidence for them, so they're willing to go longer. They may be willing to, work on walking faster, work on, weight shifting onto the involved side that they may not do in an overground situation. They can work on those functional task-specific activities. So they can work on gait training, they can work on multitasking. So things where they can kind of prepare for returning to overground, real-life functional situations. So safe progression to facilitate motor learning. With the video monitoring system, our StrideSmart technology, patients can actually see data which provides them visual feedback. They can respond to verbal cues from the PT, the clinician, to allow themselves to correct their gait. So increased repetition of these task-specific skills encourages motor learning. For patients in skilled nursing facilities, geriatric patients that may want to come in to outpatient facilities, we can really help them with a host of issues that they develop. That's just part of aging. So deconditioning, the cardiovascular conditions, functional decline, and then especially fall prevention. So the fall-safe environment of the AlterG allows patients to work on their gait patterns, and they don't require constant guarding. As a physical therapist, we always, put patients into a gait belt, and we're right by them in case something happens. Well, in the AlterG, it's a fall-safe environment. If you have body weight support, the patient, even if they slip, they're not going to land or they're not going to hit the treadmill. They're also able to multitask. So gait for people that are deconditioned, that are recovering from neurological condition, it's a very inefficient, labor-intensive task. They focus on the next step. They aren't able to walk as efficiently. They aren't able to multitask. So in the AlterG, you can start having patients do that. They can work on adding cervical rotation to walking. They can work on reaching. They can do other extremity activities while they're working on their gait pattern. Safe repetition for conditioning and falls risk reduction. So again, patients can work longer. They can walk faster. And there is a correlation with walking speed and morbidity, mortality. So getting patients walking at an appropriate speed helps to decrease fall risk, increase overall health. So AlterG is a great tool to help increase patient safety by encouraging multitasking, working on their gait pattern, working on their confidence, so they can return home safely and independently. And then in athletic performance and fitness. So aerobic conditioning, overspeed training, and weight loss. Those are some of the ways that athletes are using the AlterG in their programs. So for aerobic conditioning, they can train in the AlterG with less impact to decrease the chance of overuse injuries. So especially for athletes training for half marathon, marathons, there's a lot of volume involved. So the last thing you want is when it gets close to race day, you don't want to develop some type of injury that's going to hamper the race or even cause them to miss it. So by training in the AlterG 1 day a week at 90% body weight, 80% body weight, you can still get cardiovascular conditioning, but there's less impact and less likelihood that you could develop, an overuse injury. It's a great way for, private practice clinics to market to run clubs, to athletes, to get them to come in and use the AlterG in a cash pay scenario, develop an alternative source of revenue, as we all know, to combat declining reimbursement from insurance companies. Safe overspeed training. So a lot of athletes are using the AlterG to perform some type of overspeed training to try and improve athletic performance. For those that are deconditioned, that are trying to get back into fitness, it's a way to have an easier starting point. So if you can't tolerate, walking as long on a regular treadmill or an elliptical, you can start easier on the AlterG, because we all know for those that are trying to get back to cardiovascular fitness or lose weight, you've got to train consistently for an extended period of time. You can't just be on a piece of equipment for 10 minutes or 15 minutes. You got to be really on it, working out to get the caloric expenditure that you need. So in the AlterG, you can reduce body weight. You can start again at 80%, 70%, and hopefully whoever is using it can be on for 45 minutes, an hour. So another great way for physical therapy clinics to reach out for another cash type of revenue. And then for those who are trying to lose weight, it gives them the opportunity to see what things would feel like at their ideal body weight. So if you're 200 pounds and you want to get to 180, you just see what it's like at 90% body weight. Or if you want to try to get yourself down to 170 or 160, you just go to the corresponding body weight and you can see what it feels like on your lower extremity joints. You can see what it's like to run at that body weight and how much easier it is. So the AlterG can provide safe training progression for a variety of patients. So I hope that provides you a little bit of insight into the AlterG technology, the use of differential air pressure. It's not really new body weight support. It's been out in physical therapy for a while. It's done with harnesses. It's done with pools. There are other ways to provide it. At AlterG, what we feel we've done is with the air pressure technology, we've captured a larger patient population. We're able to use this type of theory, this type of modality with more patients in more situations with just one product. So if you're going to add something to your facility or add something to your clinic, the AlterG, we feel, provides a much better treatment option. Patients enjoy it. We get great feedback, and with the addition of StrideSmart technology now, you've got a tool that can provide real-time gait analysis at a fraction of the cost of some of the more expensive technologies out there. So hopefully that provided you, again, some good information that you can use. I guess we'll open up to questions now. Amanda will field those, and then we can try and answer any questions you got.
Thank you so much, Jacon, and we really appreciate all the information. As a reminder to everyone listening, you can go ahead and type your questions into either the Q&A box or into the webinar chat box. I do see quite a few of those coming through, and we will try to get to all of them. Jacon, the first one, and I think you addressed this a little bit, but there seems to still be some questions about it, is how does being enclosed in the AlterG bubble and wearing the AlterG spandex shorts affect normal gait and mechanics, if at all?
So the studies that we have that have looked at EMG activity and gait mechanics, we've seen that the EMG activity peaks are less because with body weight support, there's less ground reaction. And because there's less ground reaction force, you don't really need to activate the muscles as much to affect impact on the joints. So the peak EMG activity is reduced, but the EMG firing patterns are preserved. So what that means is, when the quads would fire, when the calf would fire during, heel strike at terminal swing, versus what's active during stance phase, terminal stance, those muscle activities are preserved. It's just that they're not as strong because you're not loading below extremities as much.
Great, thank you. Are there any limiting patient dimensions in regards to height or weight?
There are some considerations. So, we can provide you more information with that, with product questions and emails if you want to reach out to AlterG on that email on the website, PowerPoint presentation here. But in general, there is height restrictions because if their lower extremities are too long and they actually want to run, then when their leg is in the terminal, when they're in the back portion of their swing, at terminal stance, when they're about to kind of perform swing through, then they could hit the back of the bag if their legs are too long. Another consideration is girth. So if someone is above a certain girth, they're not going to be able to fit into the cockpit. And then the treadmill has a weight limit to it. So you can't load someone that's too heavy into the AlterG because the treadmill won't support that.
Fabulous, thank you. Can athletes train for longer runs in the anti-gravity treadmill?
Yeah, absolutely. We've got marathoners that do it. People that usually run outside typically don't like running on a treadmill. They find it boring. It's monotonous. But you absolutely can, and so what they'll do is maybe hook up an iPad and watch a movie, or they'll find a way to make it more interesting. But yeah, you can be in there for extended periods. And again, you can get a training effect with less impact.
Fabulous. What patient population should not use the AlterG? Are there any contraindications?
There are a few contraindications that we list. The only three are if they have unstable fractures. Of course, that they wouldn't be released for weight bearing anyhow. So anybody with an unstable fracture should not be using the AlterG. If they've got an active DVT, again, these patients probably wouldn't be doing therapy. And then if they have cardiovascular hypotension, so if they've got low blood pressure, the reason for that is there's a little fluid shift from the lower extremity to the thorax. And so when they exit the treadmill, we don't want the fluid to shift back too quickly to the lower extremities, which might lead to an episode of syncope or fainting. So those are the really only three contraindications. Again, I always tell people it's not if patients are appropriate, it's usually when.
Thank you. And it looks like our final question as of right now is it possible to train pediatric patients?
Yes. So again, we have to consider there's a weight limit on the low end as well. So if patients are too light, then we're not going to be able to get the calibration through the treadmill to provide body weight support. But we do have pediatric facilities that use the Anti-Gravity Treadmill, and we can always connect you with them if you want more information about an application with those patient populations.
Thank you, Jacon. It looks like we do have a couple more questions coming in, if you don't mind.
No problem.
Wouldn't using the AlterG help with blood clot breakup and DVT? Why can't you use treadmills with active DVT?
I think, in therapy, the concern is always if you release a clot, where does it go, right? So again, that's up to the discussion with the physician. If the physician is okay with the patient exercising, they have no problems with them, then yeah, I think it's fine. But a lot of times with an active DVT, they may want the patient to rest, to wait for things to clear up before proceeding, even with simple rehab activities. So just check with the physician, make sure it's cleared. We always, list that as a contraindication for, just being safe, not wanting to release that clot and have it travel somewhere else in the body.
Thank you, Jacon. So everyone, if you have any other questions, you can go ahead and reach out to us at info@alterg.com. You can also visit our website, alterg.com, and see a number of case studies and additional clinical information there, as well as some videos that you may find useful. If you have questions about the products, anything at all, please reach out. And if there's any other questions following this just about the webinar that Jacon has presented here, you can also go ahead and reach out to us via email. Our next webinar will be publicized on our website, and we'll make sure you all get that, as well as a recording from today. Thank you so much for joining us, and we look forward to talking to you soon.